All right, so welcome back. It's Dr. Betsy Greenleaf, and we're here with another episode of Body, Mind, Spirit. And I'm so excited today because we're going to be talking with the bone coach, Kevin Ellis. Thank you so much, Kevin, for being with us today.
Betsy, thanks so much for having me. I'm glad to be here.
So, how did you become the bone coach?
That's a good question. So, and really for me, bone coach is helping mostly women 45 plus, 45, 65 plus that have maybe osteopenia, osteoporosis, build stronger bones. That's the entire focus. And a lot of times people are like, well, what's a young male doing talking about osteoporosis? And for me, my personal health journey was kind of the impetus for that. And it actually started when I was a lot younger. When my mother was 5 months pregnant with me, my father was told he had cancer. And 2 months after I was born, he passed away. And he was 35 years old. And my entire life, I had this fear that I was going to follow in his footsteps to an early grave and not have the opportunity to watch my kids grow up and experience the joys of being a father. And when I was diagnosed with osteoporosis in my early 30s, at a
Wow.
time when I was still struggling with all these other health issues, gut health issues, celiac disease, malabsorption, nutrients for many, many years, and just a slew of other issues. I thought my fate was going to be the same as my father. And with young kids and a child on the way, it was devastating for me. And I realized at that point, failure was not an option. I had to figure out what I needed to do to improve not just my health, but also my bones. And, I did the research, consulted with a lot of people, spent a lot of money trying to figure things out. And eventually I got the right plan in place and started making progress and improvements. And I realized along the way that it's usually not the average 30-year-old male that has, this diagnosis. It's usually the woman who is 45, 50, 65 plus that's diagnosed with osteopenia and osteoporosis. And I realized just how challenging it is to make sense of what has to be done to actually improve, because the standard recommendation is usually calcium, vitamin D, walking, and a bone medication. And that is woefully inadequate. And that's the reason why I started Bone Coach and bonecoach.com.
Dude, those are such good points. But first of all, I'm going to start out. What exactly is osteoporosis and osteopenia?
That's a great question. So osteoporosis literally means porous bone. And it's a condition that's characterized by either not enough bone formation, excessive bone loss, or it's a combination of the two. And in osteoporosis, both your bone density and your bone quality are reduced, which that's going to increase your risk of fracture. And the way you find out you have osteoporosis is through what's called a DEXA scan, dual energy X-ray absorptiometry. And what that is, it's a painless test, kind of like an X-ray, but very low levels of radiation. You lay down on the machine does a scan, and it tells you your bone mineral density, the actual mineral content of your bone. And then it generates a score. And that score is called a T-score. And a T-score is telling you how much your bone mass differs from the bone mass of an average healthy 30-year-old adult. So if you got a score of 0 or +1 or -1, that's considered normal and healthy. If you have a score between -1 and -2.5, that indicates you have low bone mass, oftentimes called osteopenia. That's like a precursor to osteoporosis. And then if you have a T-score of -2.5 or lower, that indicates you have osteoporosis. And the greater that negative number becomes, -2.6, -2.7, so on and so forth, that's the more severe the osteoporosis is. And most of the women are getting these scans done by the time they're in their 50s, their 60s as a check in the box. Their doctor's going to order them, but that's too late. So if you haven't already had one, it's a good idea to get a baseline. We don't want to avoid doing things also just because we might not want to hear what the outcome of that is. So.
And then you bring up such good points. I mean, here I am a physician and gynecologist, and this came up a lot of times when I was practicing. And what you said was the treatment for this was exactly what we were told, like calcium, vitamin D, like walking. And then here, let's throw you on one of these many, many, many medications that are out there. And so I was going to ask you, I know that that's got to be pretty antiquated. Like, what should be people really doing to support their bones?
Well, the first thing, let's say somebody is told that they have osteopenia or osteoporosis. I like to use the analogy of a bucket, like a bucket of water. So imagine you have a bucket that represents your body. The water within the bucket represents your bone mineral density. And imagine that bucket has a small hole in it with a very tiny leak. And over time, over years and years, that water level gets lower and lower and lower until one day you realize you have low bone density, osteopenia or osteoporosis. And you're shocked because you thought your bucket was full of water. And either it's one of two scenarios. Either you got a bunch of other health issues and that's what led you to get the DEXA scan, or you're on the opposite end of the spectrum. You work out, you think you're eating healthy, you're doing all these things right. You get a scan as a check in the box, but you find out you have it. And in either of those two scenarios, you feel like, oh my gosh, I have to do something right now. But a lot of times we take action before we even understand, is there a hole in the bucket? What's causing the hole? Or was your bucket just not full to begin with? And that starts with understanding, is there a hole in your bucket? Are you still actively losing bone right now? A single bone density scan will not tell you that. So there is a test called the serum CTX test, a CT low peptide test. And what that test does is it looks at the activity level of cells that are breaking down or resorbing bone. And if that activity level is elevated or even really high, that's going to be an indicator of that active bone loss. So that really has to be the first starting point. Before you start making decisions, you have to get some objective data and information first. And that's a great starting point. The next part of that is understanding, let's say that is elevated, okay? And there is something that has to be addressed there. We have to know what is causing it, what caused the hole in that bucket or is causing that hole. And a lot of people don't know this, but there are multiple types of osteoporosis. You've got primary osteoporosis, and that's going to occur typically related to a decrease in estrogen in postmenopausal women. Estrogen has a protective effect on bone. When those levels decrease, as they do during menopause, that causes an increase in the activity level of cells that are breaking down bone. But then there's a whole nother cause of osteoporosis, and that's secondary osteoporosis. And that is going to occur because of either behaviors, conditions, diseases, disorders, or even medications. And most people who are diagnosed, especially earlier, they have or had a secondary cause. So we never want to make an assumption that it's just hormones. There could be another cause, and we want to explore that. And that's why I said, the standard recommendation that's immediately made, calcium, vitamin D, walking bone drug, we really have to pause and, again, make those objective, educated, informed decisions. And that usually starts with testing too.
Yeah, I think it's so, you reminded me, I'm like, oh shit, I haven't gotten my DEXA scan. It's like been 10 years since I got a baseline one, and I'm like, oh yeah, you know what? Time flies. I haven't gotten a follow-up one. So
Yep.
I think that's going to be on my list of things to do this year. So, um, is there something that we can do to kind of keep our bones healthy to begin with?
Yeah, absolutely. I mean, some of the basic recommendations are there are some simple things that you can start doing. Number one, I mean, figure out where you're at. Like if you do or don't have osteopenia, osteoporosis. If you do, that's the first, what I just talked about. That's the first place you have to start, is figuring out what's going on. And whether you do or you don't, I would still say the next place is digestive health, gut health. That's a really important part of this picture too. And a lot of people don't realize, you may be eating healthy, you may be eating organic and, not eating a lot of sugar and all this other stuff, but you still might not actually be getting the nutrients you need to support a stronger bones and a healthier body, because that happens on 3 levels. The first layer is, are you taking in the right nutrients in the right amounts? The next layer is, are you actually absorbing those nutrients? And if you have overt digestive issues, that can absolutely be an indicator that absorption is a problem. But if you do have those digestive issues also, it could be a source of inflammation that contributes to bone breakdown in the body. And then the third layer of that is, are those nutrients making it to the cell level? So all those things have to line up. And a big part of that is, like, let's say, in terms of gut health, if you have bloating, belching, burping, gas, constipation, diarrhea, IBS, loose stools, fatigue, any of those things right now, or maybe food just sits in your stomach and stagnates for a long time, there's a good chance you could potentially have low stomach acid, right? That's one thing that could be taking place. And if you have low stomach acid, a lot of times, what do people take for them? PPIs, right?
Yeah.
Proton pump inhibitors. And that same thing I took for a number of years. And a lot of times what happens is they'll suppress what little stomach acid they do have. And when you do that, you can't properly absorb key bone healthy nutrients. You can't absorb, it's going to be hard to calcium, magnesium, iron, B12. Your bones are going to be starved of those nutrients and others. So that's one area that has to be addressed. Another one is if you have maybe small intestinal bacterial overgrowth, or if you have some other digestive issues, maybe there's a gut infection or parasites or pathogens or something like that that has to be addressed. And then there are some other conditions and diseases that can affect your ability to absorb nutrients. Celiac disease. That is a disease, an autoimmune condition where the consumption of gluten actually damages these tiny little hair-like projections in your small intestine, and it can prevent you from absorbing your nutrients. So what happens is you ingest gluten, these tiny little hair-like projections, these nutrient absorption centers, they start to get blunted over time and they can't do their job. And that's what happened with me too. You can't absorb those nutrients, your body can't put them to use. So any of those digestive issues, you have to address those things. That's a really key part of that.
This is great. And, I can't wait to find out some more when we come back from the commercial break.
80% of women will develop a pelvic health condition at some point in their lives. There is relief. There is hope. The Pelvic Floor Store, your resource for personal health.
All right, so we're back talking with Kevin Ellis, the bone coach, about all things having to do with bones and osteoporosis. So yeah, I wanted to ask you, I think it's so interesting too. And I always like to relate this to myself because that's how I understand things. And I know that for years I was taking vitamin D and we kept checking my vitamin D level and I wasn't absorbing it. So I definitely had gut issues that I've spent a lot of time fixing myself. But let's just say, like, in somebody who's like gut is optimal, what should we be eating? What kind of diet should we be doing for bone health?
Yeah, and a lot of times people ask me, like, what is the perfect diet, right? For osteopenia, for osteoporosis, for bone health. They hate my response, but I just say in general, it differs for every single person, right? We are all biochemically and genetically unique individuals. We're going to respond to different foods, supplements, all those things differently. And, that's why when you hear people saying, like, this is a superfood, everybody should eat this specific thing. That's great. Make note of it. But just keep in mind too, if it creates inflammation in your body, it's not a health food for you. And then also your dietary approach is going to differ significantly if you are trying to put autoimmune disease in a remission, or you do have those gut health issues or something like that. But now let's zoom out and say, generally speaking, anti-inflammatory diet, obviously is going to be really important. But then also I would say there are some foods that generally speaking work well for a lot of people, and that most people can incorporate into their plan and it's going to be okay for them. And they're great foods to help support bone health. So the first one would be different kinds of fish. So, and you can eat, fresh fish, but also the canned fish that has bones in them. They're like really soft bones that almost, as non-palpable as this may seem, they'd almost melt in your mouth. But it's salmon, mackerel, sardines. Those are all great sources that also have the bones in them too. There's a brand called Vital Choice out there that has really high quality fish products that you can get. But basically, when you're consuming these fish, that have bones in them, they not only have a great source of protein. Protein is really important for building muscle, building bone, but they also have all of the minerals that your bones need. So they've got calcium, they've got all these different other minerals that are super, super important for you. And they have omega-3s, which is a type of fatty acid that can help dampen inflammation in the body. And inflammation contributes to bone loss and bone breakdown. So fish is fantastic, especially if you get the bones in. Coconut oil. Coconut oil is a great, it's considered one of the healthiest foods on the planet, over 1,500 studies showing its benefits. It's great for not just bone health, but energy, weight, brain function, heart, memory, skin, hair, teeth, gut health, all those. But for bones specifically, there have been some studies that even looked at that it might not just be helpful in the protection against bone loss, but also in the actual improvement of bone structure. And that could partially be due to the polyphenol content within them, which those actually help protect cells and tissues from damage. But coconut oil also contains a type of fatty acids called medium chain triglycerides, and we'll call them MCTs. And MCTs are metabolized differently than other fats. What happens with them is they go straight to the liver, okay, where they're converted instantly into energy and ketones. And ketones are an efficient, clean burning fuel source for the body. So it's also got some antimicrobial and effects that are great for gut health. Arugula. Arugula is another great one. A lot of times when people think about leafy greens, they most of the time they think about spinach, but spinach is high in something called oxalate. And oxalate is an anti-nutrient that binds up bone healthy minerals like calcium. So if you're in the grocery store and you look at a carton or container of spinach and you see that it's got all this calcium in it, well, that calcium is bound up and it's not actually bioavailable. So you can't count that toward your daily total. So arugula, though, a great leafy green, great source of folate, vitamin C, vitamin K, and calcium, bioavailable calcium. And so that's a great swap, especially if you're somebody that may be sensitive to oxalate or may have trouble breaking down or degrading that oxalate. That could be an indicator by maybe joint pain or digestive issues or kidney stones, arthritis, those kinds of things. So just swap that spinach for the arugula. And you don't have to avoid every single food that has oxalate. That'd be very, very hard to do. Probably wouldn't even be something you'd want to do, but it could be helpful in some situations. Those are some of the high level ones. And then vitamin C rich foods. That'll be the last one I touch on, which is key nutrient for body and bone health, vitamin C. A lot of people don't know this, but vitamin C is needed to form blood vessels, cartilage, muscle, and even the collagen in bones. Your bones are made up of this collagen protein matrix upon which minerals are laid. And what vitamin C is going to do is it's going to stimulate procollagen. It's going to enhance collagen synthesis, and it's going to stimulate these markers for osteoblast bone building cell formation. So it's super, super neat. Those are some great examples of just some high level foods that usually work pretty good for most people.
Yeah, you see everywhere all these, supplements that are kind of saying like, hey, we help with bone health. And you see them. I always laugh about the ones that are like the sugar chews, the calcium chews, where they got all these sugar in them.
Yeah.
So what do we really need to know about these supplements that are out there?
Yeah. And a lot of times I would just be aware of some of the branding of things. If there is no magic pill in the world of bone health and osteoporosis, that's the first thing everybody should understand. Is if you think that, it's just going to be one supplement or something like that that's going to turn it all around, I can tell you, after working with a lot of people, I can tell you that's not going to be the case. So those don't exist. You really have to take a step-by-step approach. Supplements, quality does matter. That's super important. You want to get the right forms, the right amounts. Even specifically with something like calcium carbonate is one of the most poorly absorbed forms, but it's in most everything. And a lot of times even people take Tums to suppress some stomach acid, and they also see it as calcium in it. But that's not going to be a good source. either. So be selective about your supplements. And a lot of times there's going to be some individuality there also. What you usually want to do is you want to zoom out, look at your dietary plan, see where you're falling short in terms of the nutrients that you actually need, and then close that gap with supplementation if and when necessary. That's a good starting point for an approach like that. And you did mention sugar in some of these different supplements and the chews and things like that. So sugar, most people know to avoid sugar. But if you didn't already know that, I'm going to give you one more reason for bones. In terms of sugar, sugar actually damages bone by triggering an inflammatory response. It's going to lower your vitamin D levels. It's going to deplete bone healthy minerals like calcium, magnesium, chromium, and copper. It's going to inhibit intestinal absorption of calcium, and it's going to block the absorption of vitamin C. Remember, I was just talking about vitamin C a minute ago. Vitamin C is key for developing the skeleton and maintaining it. So that's super important. And when I say sugar, I don't mean like berries and fruits and things like that. I mean, the candies and cookies and cakes and all that kind of stuff. So
yeah, all the things I try not to be addicted to anymore. But which actually, if you get your gut health in balance, I will tell you, a lot of those sweet cravings go away, which is amazing. So it's much easier to get rid of those things out of the diet.
And if you're incorporating coconut oil too, coconut oil, if you're even having those kinds of cravings too, having even just a tablespoon of coconut oil occasionally can actually help with some of those too. Oh,
that's great. That is great. Now, I hear a lot about exercise and bone health. Is this true or fact or fiction?
Oh, it is 100% true. Exercise plays a major role in bone health. There are two different types of stimuli when it comes to exercise that you need to have to support healthy bones. Number one is muscle pulling on bone. Number two is impact. Okay. And the most effective interventions are going to use a combination of the two of those things. And when muscle pulls on bone, it's that mechanical signal is sending a chemical signal telling that bone to become stronger. And then you've got impact exercise, which again is also telling that bone to become stronger. But then there are different types of exercise. Most people hear like I had mentioned at the beginning, go for a walk, do some walking. That'll be enough. Well, I can tell you walking is not going to be enough. Okay. Walking may help you maintain bone density, especially if there's not an underlying cause, but it's not going to be something you should rely on for bone building. But when we talk about weight-bearing exercise, that's any kind of exercise where your bones and your muscles have to work against gravity to keep you upright. So these are things that you're doing on your feet that are placing some stress on your bones. So it could be hiking, dancing, gardening, playing tennis, jumping rope. Those kinds of things would all be considered weight-bearing exercise. Then there's lower impact weight-bearing exercise, which would be like an elliptical machine or something like that. But those aren't really going to be the best things to support your bone health. And then in terms of muscle strengthening exercise, that's one of the other things that we have to incorporate. So you have to actually be doing some kind of resistance exercise that involves working your muscles against an opposing force. That really is going to help with the actual building of muscle and bone strength. So some of those things could be lifting free weights, using weight machines. You want to make sure that if you haven't done these things before or already, that you don't just jump in and start doing them without really understanding proper body mechanics and good form, because it can lead to injury. So you want to make sure you do the right things. And especially because the studies that show the greatest impact or effect on bone show that the number of repetitions and the intensity is in that little bit lower range. It's on the 5 to 10 repetition side. And that's what's going to show the greatest effect on bone. So especially if you're not familiar with how to do some of these lifts, you want to make sure you get a little bit of guidance to do that.
Kevin, this information has been amazing. Where can people find out more information about you?
You can always find me over at bonecoach.com. That's where all of our resources, that's like our hub. We've got different social channels on Facebook, YouTube, Instagram, all over the place. But then also we have over at strongerbonesmasterclass.com, we have a free 50-minute training that walks you through step by step how to create a stronger bones plan.
That is great. Thank you so much for being with us today. I just want to remind everybody, make sure you go check out Kevin's website and his social media. When you're there, also swing by wytv7.org and check out all our other programs that we have on our broadcasting network. And don't forget to hit the donate button, because every dollar that you donate helps us to bring great programs like this today. And also you can see all the wonderful programs that we're doing in the community, and you're helping us support that. Also, don't forget to follow me on social media. I'm Dr. Betsy Greenleaf, or Dr. Betsy Greenleaf _ on Instagram. And don't forget also to tune in next week for another episode of Body, Mind, Spirit.